This is Albert Diaz performing his head-to-toe assessment. Overall inspection of the room. There are no notes, any verbal cues to assist me. Hello.
Hello.
My name is Albert Diaz. I'm going to be the nursing student performing a head-to-toe assessment on you. How may I address you?
Ray.
Okay. Thank you, Ray. The assessment that I'm going to conduct is going to be involving me palpating, touching you, listening to your heart and lungs, and actually just an overall head-to-toe assessment. Do I have your permission?
Yes.
Perfect. I've done my hand cleaning. I'm going to start with the scalp, and I'm just going to follow. I'm going to place my hands on your head just to evaluate. And I'm going to come across the front. No deformities noted. I'm going to look at the hair and look for any marks. No dry patches or anything noted within the hair. Next, I'm going to go into the eyes. I'm going to look at your eyes if you don't mind. And with this evaluation, I just want you to look forward. I'm just looking at the size of the pupils, and they're equal. They measured about a 3. I'm going to shine a bright light in your eyes and just to kind of check how they react, okay? And so, good reaction. Good reaction. Perfect. Next thing I want you to do, I want you to kind of follow my pin and follow this point right here, just with your eyes without moving your head. And I'm just going to go here and up, all 6 points. Good. Across. Down. And no abnormal findings. Eye movement is equal. The next part is a little different. It's going to be a little, I'm going to make you kind of go a little cross-eyed, unfortunately, but I want you to follow this here. I'm checking for the strabismus of the eye. No additional ocular movement. Accommodation is normal. I'm going to then inspect your eye. I'm going to pull the eyelid down just to inspect the eye. The conjunctiva is normal bilaterally. The sclera is white, and eye movement is equal and round and reactive. Next, I'm going to go to the ears. I'm going to check the external ear. The external ear presents with no deformities, no redness, no swelling. Have you had any earaches recently? No. Excellent. I'm just going to place the speculum inside your ear and take a look inside. Tympanic membrane is gray in matter, no wax noted. Same thing with the other side. I'm going to check the ear, check behind the ear, nothing noted. I'm going to place the speculum inside your ear. And tympanic membrane is gray in matter, no discharge, no tenderness when I look in there? No. Excellent. Next, I'm going to move to the nose. As far as the nose, I'm just going to place my hands on your nose just to palpate. Have you had a broken nose ever? No. Excellent. Can you do me a favor? Can you tilt your head? I'm just going to check the nerves. Perfect. Now you can bring your head back to normal. If you can close one of your nostrils and in and out. Perfect. And the other. Perfect. No airway is patent and no tenderness there. Sorry, I don't mean to get your nose in. And I'm just going to help you along there. No pain anywhere there. Excellent. Next, I'm going to move to your mouth. I'm going to have you follow some simple commands. If I can have you smile for me. Smile is equal and bilateral. Next, I'm going to do is I'm going to examine your mouth. Okay, I'm going to use a tongue depressor to assist you to inspect your mouth and look at your cheek dentation. I'm going to have you open your mouth nice and big for me. The gums are pink and moist. Can you lift your tongue up for me. Sublingual area is red, moist, no lesions noted. Do me a favor, bite down, show me your teeth. Good. Open your mouth one more time. And can you stick out your tongue for me? Tongue is pink, beefy red, no exudate or white patches noted. I'm going to check the uvula. Say ah. Perfect. Uvula is midline, tonsils are present, no exudate noted. Redness, no erythematous areas noted. As part of this, I'm going to do the quick olfactory check. It's part of the nerving. If you could close your eyes for me. I'm going to put something in front of you. Just tell me if you can smell it.
Yeah.
What do you smell?
Gum.
Okay. Good. Good. Excellent. Okay, you can open your eyes. Next thing I'm going to do is I'm going to palpate the lymph nodes. I'm going to be placing my hands in front of your ears and behind your head. Okay. I'm going to palpate the lymph nodes anteriorly and posteriorly. And you'll see the occipital region. Any pain or tenderness?
No.
I'm going to come along the mandible and no tenderness there. I'm going to go along the clavicle, going for any lymph node activity. And then I'm going to check the axilla area for any lymph node activity on that side and no lymph node changes there. Perfect. I'm going to go ahead and look at your neck. If you could do me a favor, if you could lift your head up, I'm just going to, and give me a good swallow. Okay. Trachea is midline. I'm going to go ahead and check your carotid pulse. Okay. Nice strong pulse, 2+. There. I'm also going to examine your thyroid. Feeling anything there? Great. I'm going to go ahead and listen to your carotid arteries for any thrill or brewery. And you could just breathe normal, okay? No thrill or brewery noted with the carotid arteries. Next, I'm going to listen to your lungs. As I listen to your lungs, I'm going to listen anteriorly and posteriorly. Then I'm going to palpate along there just to kind of listen for lung sounds, okay? All right. Do me a favor, take a nice deep breath and out. Good. Once again. And out. Good. In. And out. Good. And out. And out. And out. And out. And out. Now I'm just going to percuss. No dead sounds heard. I'm going to listen to you posteriorly. Take a nice deep breath and out. 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 Lung fields are completely clear to auscultation. The next thing I'm going to do is I'm going to have you say the words 99 when I'm listening to your lungs posteriorly, okay?
All right. 99. 99. 99. 99. 99. 99.
No, 99 was heard clearly. No abnormalities found. I'm gonna next listen to your heart. I'm gonna listen to the different valves and go across your chest as I listen to them. Okay.
All right.
I'm gonna start at the aortic valve. the pulmonic bulb, Erb's point, tricuspid valve, and the mitral valve. Perfect. S1, S2 heard, no gallops, no murmurs, or S3 sounds heard. I'm going to check your brachial pulse. That's just inside your arm here. Brachial pulse is good. I'm going to check your radial pulse. 3+ on both. I'm going to look at your fingers. Fingers are cool, warm, dry. Capillary refill less than 3 seconds on all digits. Same thing with this side. Check your brachial pulse. Good, strong brachial pulse. Good radial pulse. Once again, looking at the fingers. Capillary refill less than 3 seconds. No tenting noted on the skin trigger. Skin is warm, dry, and intact. Next, I'm going to check your femoral pulse. I'm going to have you kind of lay back. I'll assist you back if you don't mind. If you need some help, you can go ahead and lie back. You can trust it. It's good. Okay. I'm going to check right in here at your femoral area. Femoral pulse is strong. And strong. I'm going to check behind. You can go ahead and sit up. You're good. Okay. I'm going to check. You'll just put your foot flat on the ground. I'm going to check the popliteal pulse. Popliteal pulse is good. I'm going to check the posttibial pulse. Good pulse. And the pedal pulse. Pedal pulse is good. Checking the nail beds for capillary refill. All less than 3 seconds. No edema noted to the right lower extremity. I'm going to check the popliteal on this side. Popliteal is 2+. Pedal pulse. Good strong pedal pulse, 2+. Posttibial pulse is good. Capillary refill on all toes is less than 3 seconds. No swelling or no swelling noted or any redness. Next, I'm going to listen to the abdomen. Okay, this part I'll have to have you lie back so I can have you. You need help getting back? Okay. This part of the exam is just the abdominal exam. I'm going to first listen for an abdominal aorta. I'm going to press a little hard. So my umbilicus is here. It's going to be a little firm. Just listen for an abdominal aorta aneurysm. None noted. I'm just going to listen to the bowel sounds normal. Abdominal sounds are normal active in all quadrants. And I'm just going to palpate along, feeling for any masses. No masses are noted. And I'm going to press a little firm here to feel the tip of the liver. And no enlargement of the liver is noted. I'm going to percuss across the abdomen. None were found. I'll assist you up, sir. Last thing I'm going to do is I'm going to check your strength. If you'll grab my 2 fingers, give them a nice tight equal squeeze. Good. Do me a favor, hold both arms up. Good. Hold against resistance. And then opposite. Good. And you can go ahead and relax your arms. I'm going to do the same thing with your leg. If you can have you lift this leg up against me. Good. And then pull back. Pull down. Good. And then same thing here. And then pull down. Good. Now I want you to push against my hand. Good. And pull back. Strength is strong. Again. And back. Good. The last thing I'm going to check is it's called the Thompson's reflex. If I can have your leg, I'm going to borrow your leg real quick. And what I'm looking for is that little reflex right there. Just how the foot goes down. Thompson's reflex is positive. Achilles is intact. There we go. Good. Do you have any skin issues, any pain issues?
No.
No lesions, nothing like that. I'm just gonna give an overall inspection. If you could lift your shirt up real quick.
Should be proper.
Yeah, just like that. That's good enough. I'm not gonna do the full inspection. Good. No lesions or anything noted on the skin. You can go ahead and lower it, sir. And that will conclude my assessment.